Hi there, my name is Morgan Risden and I'm the creator of Center Studio, where I teach people skills to feel more comfortable more often. Now, earlier this week, somebody posted on one of the many moms Facebook groups that I'm on about something that some of you might have heard about before called Dowager's Hump. Sometimes people think of kyphosis or what have you, but I think that has to do more with your thoracic or your sacral part of your vertebrae, as opposed to, say, your cervical, like up here in your neck. And so Dowager's hump, as it's known, is sort of that hump that older individuals typically get, but you might be saying, Morgan, I'm not very old and I feel like I already kind of have that. And it can be something that maybe doesn't even cause you pain, but just out of vanity, you don't really like and you feel as though it's something that you would like to get rid of or that you wouldn't like to have be as noticeable. And so this mom brought this up, and I was surprised to see so many people had also been dealing with this and were wondering, how can I fix it? And so I thought I would talk a little bit about that today with regard to how we use ourselves. So as an Alexander Technique teacher, I'm always talking to individuals about the use of their body. How do I use my hands? How am I using my head or my hips? Or am I not using them at all, right, in different activities? And so there may be an underlying genetic component sometimes to things that a student is dealing with. We call that a condition of use, meaning that is the way that you are. However, there's a lot of things that we can do with regard to how we work within those conditions. How am I handling myself despite the fact that genetically I'm more prone to this or to that? And so let's just assume for today's video that you do not have any genetic disposition to having some sort of curvature of your spine, and that instead this is purely use related, meaning that how you're using your body is contributing to this hump that's starting to develop at the base of your neck, okay? And I'm going to suggest that it is probably most likely due to the fact that you are using your head as a joint with regard to your neck. What do I mean by that? I see so many people using devices, using their head with regard to their devices as though it's an independent joint. And you'll see, oh, let me text you. Oh, what does that say? Oh, I can't read that. And you see this constant pulling forward. I think a lot of chiropractors or physical therapists will call it head forward position. And in Alexander Technique, we actually call it head back and down, because when we pull the head forward, the head is turning back and down on the top of our spine, so up here. So if you think about, we want to keep this part of our neck elongated and much longer. Our head, when it's coming, as others call it, forward, it's actually pushing our head back and down here on the top of our spines. And so if you think about when you're using yourself and you tend to come forward this way, is it something that you could bring towards you with your hands? Is it something that you could move forward to with regard to using your hips? Could I use my hips to bring my whole body forward to look at it? And remembering, where is the top of your spine? So I'm going to leave that question out there just for a moment in case you don't know where the top of your spine is. And I'm going to ask it one more time. Where do you believe the top of your spine is? And whenever I ask people this question, they always kind of hesitate and then sort of come someplace around here. And I'm going to tell you today, folks, your top spine, okay, C1, is up here in between your ears behind the bridge of your nose. That is pretty far up there. And for many people, I think that this can kind of be mind-blowing because I never thought about that. I just think this is my head and this is my face and here's my neck, so this must be the beginning of my spine. No, friends, the spine goes up much further, and therefore that means where your head meets on top of your spine is going to be your first joint, your first weight-bearing joint. So your head on top of your spine sort of balances, it teeters on the very top there. And what ends up happening is, if we think about the neck, we start trying to pull these vertebrae and we try to use our neck muscles as though it's a weight-bearing joint, which of course now you know it's not, right? So while our vertebrae might be flexible, they might have mobility, they are used for rotation and flexibility, they are not intended, friends, to be repetitively used and to bear weight. So I'm going to repeat that because it is so important. Our spines are not intended to be major weight-bearing joints. So 4 major weight-bearing joints that we have, that would be our AO joint, the atlanto-occipital at the top of our head and our neck. Then it would be our hips, our knees, and our ankles. And so if you think about all these major weight-bearing joints as the places that we are moving on, when you see somebody with the Dowager's hump, right, this sort of hump here at the cervical, you know that this person is not actually using the top joint at their head and their neck. So next time you're doing something, imagine, am I moving from way up here to look down to read, or am I using my neck to look down and read, or to text, or to type, or use my iPad, or cook, or whatever it is that you're doing in your life, right? And see if instead you can think about coming a little bit higher up here to your top joint, right, your AO joint, and moving your head from the very top. Okay, just something I would love to encourage you to consider. If you haven't already, my friends, I would be so grateful if you would subscribe to my channel. You can do so at the button below. Okay, until next time, friends, take care. Ciao.